We've all heard the term vital signs before, but what exactly are the vital signs? They're pulse rate, blood pressure, body temperature, and respiratory rate. And notice that two of these three deal with the circulatory system. So let's take a look at these two, pulse rate and blood pressure. Pulse rate is technically an indirect measure of heart rate. So when we take a heart rate, we're not really putting our hand on the heart and measuring how many or counting how many times the heart beats per minute. Instead, we typically will place our fingers on an artery and feel for that expansion with each beat of the heart and then count how many expansions that we feel. There are a few common sites where you can take a pulse rate. Obviously, one of the main ones is at the wrist, at the radial artery, but it can also be taken at the carotid artery, the brachial artery, the femoral artery, popliteal artery, which is behind the knee, and the dorsal pedal artery on the top of the foot. Those are the common ones, and there are other ones you can use, but like I said, those are common. Blood pressure is another way we monitor circulatory efficiency. And blood pressure, as we know, is the pressure that blood exerts on the walls of arteries. So we're going to take a closer look at blood pressure. First of all, why is blood pressure important? Blood pressure is important because we need adequate pressure to ensure a constant and adequate supply of blood throughout the body. So basically, without blood pressure, we wouldn't have a force to deliver this blood to our capillaries where we do that lovely exchange process. If blood pressure is too low, then that means organs are not getting the blood supply they need. And if blood pressure is too high, we are at risk of actually damaging capillaries. Your kidney capillaries are very, very, very sensitive to blood pressure. So your kidney capillaries are called a glomerulus. And if the blood pressure gets too high in the glomerulus, they explode and then your kidneys stop working. So high blood pressure can damage capillaries. Another problem with high blood pressure is that high blood pressure increases afterload, which we talked about in our heart unit. Afterload, when it gets high, what that means is that cardiac output goes down. So high blood pressure reduces cardiac output, and cardiac output is measuring how well the heart is at doing its job. So basically, high blood pressure means the heart is going to do a worse job at its job. High blood pressure also puts us at increased risk for heart disease, vascular disease, and stroke. So you don't want low blood pressure and you don't want high blood pressure. You want that nice Goldilocks zone. So how do we take a blood pressure? Like heart rate, blood pressure is measured indirectly. If we wanted to measure blood pressure directly, we would have to open up people's chest cavities and put pressure, detecting devices in the arteries and things like that. And we don't do that, right? Instead, we do it indirectly at the brachial artery typically. And we do this using a sphygmomanometer and a stethoscope. Sphygmomanometer is just a fancy name for a blood pressure cuff. To take a blood pressure, what you need to do is use the blood pressure cuff to apply pressure to the brachial artery to stop blood flowing through the brachial artery. And then you listen to the brachial artery as the pressure is released on the cuff and blood begins to flow through that artery again. You note the pressure of when you hear the first sound of blood flowing through that artery, and then you note the pressure of when you hear the last sound of blood flowing through that artery. And then you have two pressures there. One is your systolic pressure, that's the first one, and the second is the diastolic pressure. These sounds that you're hearing are called Korsakoff sounds. And basically what you're hearing is the blood hitting the walls of the brachial artery. Because when you cut off that blood supply to the brachial artery and then slowly release the pressure, what's going to happen is you're going to have high-powered squirting of blood go into that brachial artery, and that blood hits the walls of the brachial artery, and you hear that. Note the pressure. That is your systolic pressure. As you continue to listen, the sounds will begin to fade, and that's because the blood is beginning to flow without any turbulence. Once the turbulence is completely gone, that's when you hear, well, right before that is when you hear your last sound, and that is going to be your diastolic pressure. So you check the pressure with that last sound, and that's your diastolic pressure. We usually state blood pressure as the systolic pressure over the diastolic pressure. So for example, 120 over 80. 120 would be the systolic pressure, and 80 would be the diastolic pressure.